hygiene and productivity.
In contemporary North Korea, the hygiene months of March and April, when inspections were carried out several times a week on everything from the maintenance of the roads, railways, and waterways to the state of domestic cleanliness, are a time of mass mobilization, often referred to hardship months. A 2012 Central newspaper editorial praised the hygienic culture program for its role in revolutionizing households and transforming cities and towns into socialist vistas of blossoming flowers and people's smiles. In North Korea today, the hygiene culture program mobilizes people from all avenues to intervene in their daily lives. In the early days of the program, which began in the 1950s, the focus was on epidemic prevention, such as controlling disease vectors and improving toilets. Then, it gradually led to a broader range of lifestyle modifications, such as planting flowers gardens in villages and maintaining roads, schools, and workplace. Everything from production sites to schools and homes were targeted. And it was repeatedly emphasized that this was the people's own business. In this way, hygiene in North Korea was not limited to health and disease, but came to mean transformation of all aspects of daily life, including home, village, and city. Understanding the daily mobilization of the entire population in the hygiene culture project, every year from the 1950s to the present, could provide a window into the daily lives of the North Korean masses, past and present. From the very beginning of the regime, North Korea recognized hygiene and epidemic prevention as important national responsibilities. The May 1947 meeting of the People's Committee emphasized the importance to expand the healthcare system and epidemic prevention. The number of doctors per 10,000 people, which was only 0.5 before liberation, increased rapidly after liberation through the establishment of educational institutions. And between 1948 and 1950, 325 clinics and basic health centers were set up. However, after the Korean War, the majority of country's healthcare system was destroyed. In the Korean War, most health facilities were destroyed and health personnel were sent to the front and killed, creating a vacuum. Particularly in the adult male population, which had plummeted during the war, the role of healthcare was geared towards preserving and maximizing the remaining labor force. The party's decision in 1954 to improve and strengthen public health work as part of the post-war recovery emphasized the need to expand sanitation work, to raise the culture of production. To this end, hygiene sought to increase the efficiency of labor by enhancing health of the masses and the growth of the working population, through improving environments for infants and children. Poor health conditions and frequent morbidity among workers contributed to a decline in labor capacity and production efficiency. During the post-war recovery, hygiene projects were forced to focus primarily on expansion of facilities and professionals, rather than on hygiene enlightenment or sanitation propaganda, which required systematic mobilization. Prior to 1957, it was difficult to implement hygiene education and propaganda projects beyond basic epidemic prevention with limited healthcare resources. At that time, the party's leadership system had not been fully established in North Korea. Also, there was a lack of organization to mobilize the masses. For example, as of October 1954, the rate of agricultural cooperation was only 21.5%. And it was not until April 1956 that the administrative and economic work of the enterprises was brought under a direct control of the party. In addition to the difficulty of mobilizing the masses based on the control of the party, it was also difficult to convince people of the importance of hygiene work. The ownership structure was still individualistic, and in the absence of a fully socialist economic system, improving the sanitation of enterprises, farms, and households was not directly linked to individual interests. The idea of having to invest personal labor and time for this was not easily accepted by people.
Mobilizing reserve for Hygiene 1.
The most striking feature of the hygiene culture movement was that the party's mobilization system now extended beyond workers to all social groups, including women and children. A major focus of the hygiene propaganda was also placed on women, particularly women as mothers. Women's hygiene was important for maintaining their own health and improving their labor efficiency. This was further emphasized by the fact that women were the primary caregivers of children. Women's level of hygiene knowledge and the care was directly related to health and hygiene of their children. Hygiene care, especially during pregnancy and childbirth, was a good way to reduce infant mortality, and thus encourage population growth. Women also played an important role in the penetration of hygiene culture project into the home, as their influence was generally stronger in each household. A typical example of a hygiene culture project for women was the Mother School, which became a space for teaching hygiene knowledge and infant care. Women who were educated in hygiene knowledge through mother schools were expected not only to take care of their own hygiene and that of their own household, but also to become active instigators of hygiene culture projects in their extended families and villages. In addition, to improve hygiene conditions during pregnancy and childbirth, pregnancy registration and childbirth support system were operated. Hygienic knowledge about pregnancy and childbirth was disseminated through midwives, and the hygiene of each family was encouraged to be improved. As children's institutions were expanded and hygiene guidance was strengthened, hygiene propaganda work was also carried out for parents through nannies at children's institutions. Also, as vaccination against childhood infectious diseases was implemented, hygiene propaganda work was carried out for each family.
Mobilizing reserve for Hygiene 2.
Involving women and students from households who were not directly involved in labor and using them as reserve workers in health projects was also linked to North Korea's economic development line of mobilization of internal reserves, which began in December 1956. With foreign aid dwindling in 1956, North Korea was faced with having to rely on domestic resources for economic development. By identifying and mobilizing excess reserve within enterprises, North Korea was able to expand production without additional investment, the low investment policy mentioned earlier. By mimicking the Chollima movement, the hygiene culture project performed the function of training and education of labor. Competitive exercises and the generalization of example were also used as major methods. Competitive exercises were arranged between cooperatives, and material inducements such as a pig or a cash prize were offered. There were even cases where husbands and wives competed to see who could keep up the house cleaner, and a scoring committee was set up. Furthermore, mobilization of reserve to reduce costs in the production sites was mirrored in sanitation renovation projects. By mobilization of local ideal materials to construct and renovate various facilities, these parallels familiarize the broader public, especially students and women, with the system of the production sites, making them a reserve labor force that could be easily mobilized when necessary. In the course of the hygiene culture projects, students and women were not only used as reserve labor force, but also as immediate and actual labor force. They were mobilized for various sanitary renovation projects, not only on campus, but also in nearby villages, and were used as main labor force, especially in the eradication of harmful insects and animals. In May 1958, Kim Il-sung demanded that the eradication of harmful insects and animals using students be institutionalized for about 3 years and carried out every Saturday at the Central Committee of the Workers' Party of Korea. These sanitation culture projects were labor-intensive, requiring a large number of workers, without requiring skilled techniques, and thus, students' labor could be used efficiently. For the same reason, women were also used as the main source of labor in the pest eradication projects through unions. In addition, the reserve labor force, such as women, students, children, and others, was made available and directly used in the project. This transformation in the hygiene culture projects was achieved through infiltration of the production and labor paradigm into everyday life, which made daily lives of the masses function as the preliminary stage of labor, and induced women, children, and students to learn the system of labor.